Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix, Arizona. I'm standing today in front of the world-famous fountain in Fountain Hills. It should turn on in a minute here. It goes on every hour from 9 to 9 p.m., and it was built back in 1970 by McCulloch Oil Corporation. The fountain is the tallest fountain in the world, to my knowledge. It spreads upwards of 560 feet, which is 3 times as high as Old Faithful in Yellowstone. Granted, Old Faithful is a natural fountain. This is obviously man-made. It was manufactured in Zurich, Switzerland by the famed Institute for Hydraulic Research. The nozzle on the fountain weighs about 2,000 pounds, and it incorporates multiple pumps that are 600 horsepower. It is an unbelievable sight to behold at 560 feet. That's actually taller than most of the Great Pyramids of Egypt, and like I said, 3 times higher than Old Faithful. Well, the topic for today is the new normal in healthcare reimbursement and ancillary reimbursement. One of the problems that we see in medicine right now is that your cost and overhead continues to go up, whereas your reimbursement is stagnant at the medical practice. I've seen this. I've been out of medical practice on the professional side for 5 years now, and I am on the business side of medicine, and it is unbelievable to me the way that most doctors look at their practice simply from a medical standpoint. But I got to tell you, 80% of a medical practice is business. There's no different, for the most part, from your medical practice than any well-oiled and run corporation. Whereas how you handle your accounts receivables, how you negotiate with your vendors, and yes, an insurance company is a vendor, how you handle your patient care, and also when you look at the products or services that you sell, how can you maximize the reimbursement for those? How can you add more into the mix? There are 3 reasons that I can think of right now that your reimbursement is either going down or stagnating. Number 1, the recession. Patients now look at their medical care as discretionary as opposed to necessary. If you really need a knee replacement, yes, it is an elective operation, but your pain can be horrific. What a patient will now do is they may negotiate on how much that knee replacement is going to cost as far as their deductible and things like that, or they may just put it off. So whereas you used to see those patients, maybe not anymore. Maybe they need some blood work. Maybe they need a form filled out. Whatever the case may be, if you charge for those services, patients are now in a completely different mindset. They will often negotiate with you on how much those are going to cost. That just didn't happen much in the past. Now I see it all the time. The second reason is the government. How many times last year, in 2010, did you see in the headlines about Medicare being cut by 21.3% because of this ridiculous sustainable growth rate formula? Now that got pushed back and stalled, I think, for another year. But you have got to be kidding me. How many businesses is it okay to go in and just say, not randomly because this has been on the books, but just say, we're going to cut your pay by 21% in a reimbursement that's already not considered fabulous. So you're taking something where there's not a huge margin to begin with, and you're cutting 21% off of it. How tough do you think it would be for seniors to find care based off of that kind of a cut? A lot of people are just going to say, no thank you. The Mayo Clinic out here, which is not too far from Fountain Hills, recently stopped taking Medicare. You think a financial decision was the number 1 on that list because of that? This is not a political video, but that is an affected financial situation for physicians. The third reason is insurance companies are run like businesses. They are publicly owned companies. They have to answer to their shareholders. And when they sit there and negotiate with you about your contract, that is a business negotiation. completely removed from patient care and what's medically necessary. My last practice, when I was leaving, we negotiated a contract for a Medicare replacement product, and the group was ecstatic that we were able to get 106% of Medicare, so 6% on top of what Medicare pays. Why is that something to be so excited about? It seemed like the partners thought that it was some kind of a coup that was negotiated, in our favor. Well, I don't see it. So take those three things into consideration. What we're dealing with now is a new normal. This is not a temporary situation that's going to revert back to the way things were back in the 1980s. That is not going to happen. What we're faced with is a situation where your overhead is going up. Are you going to tell your employees, I'm sorry, we can't give you a cost of living raise this year, or for the next 3 or 4 years, or for seniority, or for incentive because you do a good job and we like you, here's a bonus. Are you saying that you're not going to do that? You're going to do what's being done to your medical practice from these outside sources to drop your reimbursement and just say to your employees, because of that, you can't have, you're going to have a high turnover rate. What I'd like to get across today is that there are some ways to change the way that you do business. Yes, continue to take insurances and continue to provide the quality medical care that makes your practice what it is. But what I'd like to get across is the things that you do give away that are reimbursable events. Identify those and pull them back. Now, I'm in the pain management business, so I'd like to give you 5 things that I've identified that you can do to pull back. Now, there are obviously going to be specialty-specific ancillary revenue reimbursable options for you that don't exist in pain management, such as allergy testing. Are you a primary care doctor that has potentially an interest in allergy? Could you go out and get some CME courses to treat patients with allergy? Maybe you could do allergy testing in your office that does the blood test for that, or however that's done. That is something that maybe you have a patient with allergies, maybe you're giving that away to a lab. If you don't keep that money in your practice, somebody else is getting it. Okay, these are medically necessary tests or products, and you're giving them away. Pain management, for instance. Pain doctors around this country do drug test their patients. Why? Because you want to ensure compliance. 35% of pain management medication patients divert their drugs, sell them, trade them for illicit things like that. Even in the senior citizen group, we see that. So pain management doctors drug test their patients as they should. So how is that done? Well, you can do it in your office. We have options that you can do that in your office. Right now, a lot of pain doctors just send it out to one of the local big labs. I won't name what those are, but there are national labs that do it. They are making the money, and you're not. Very simple. You do a drug test, you send it to the lab, they make the money, you don't. Why? You can make as much as that as you did on the office visit. That's one. The second one would be durable medical equipment. If you order a back brace on a patient, then somebody else provides that back brace and bills for it. What have you done? Okay, you've given a patient a medically necessary product, but you've gotten nothing out of that. There are ways to pull that into your practice at not a huge outlay of cost that can be extremely beneficial to your bottom line. So all these durable medical equipment types of things, back braces, neck braces, ankle braces, splints, casts, any of those types of things that constitute a product that a patient could benefit medically from. So that's another one. Imaging could be one. I've seen the cost of MRIs come down an unbelievable amount, from over $1 million price tag down to probably less than half of that. I'm not saying go out and buy an MRI. I'm just saying look into some sort of an imaging type of thing. Maybe it's an x-ray. Maybe it's a lab. Maybe you could do hemoglobin, hematocrit in your practice. Maybe like we have a drug testing analyzer that one of my companies sells that not only does drugs of abuse, but it also does like 100 other substances, liver function tests, creatinine, CRP, those types of things can be a huge boost to your bottom line. I would like to say that if you incorporate a significant amount of ancillary revenue reimbursable options in your practice, you could probably bump up your bottom line in the next year by probably a third. Bottom line, okay? Meaning that there's a nice gross margin on these types of things, whereas what's your gross margin on your practice now? A lot of family practices are at maybe 5%, 10%. If another hit comes down the pipe from those three outer sources, you know, recessionary related, government related, or insurance company related, you might be in a break-even situation. What are you going to do then? These are the types of things to think about now. Here and now, short term, you can do these types of things. Just trying to get your brain sort of probing these possibilities. I am Dr. David Greene, Preferred Pain Center CEO. Your pain stops here.